My name is Raman Bedi. I'm president-elect of the World Federation of Public Health Associations. And I'm really delighted to have Michael Moore, the WFPHA chair of our immunization expert committee. Michael, welcome.
Thanks, Ramon, and it's my pleasure to be here and to have a discussion about our call to action.
The call to action was put together fairly recently. Concerns about the change in the policy in the United States on child vaccinations. Michael, just give us a background of why there are concerns about that policy.
Well, recommendations have been based on sound science discussed right across the world and discussed particularly by the Centers for Disease Control of the United States. Building up over many years has been a recommendation that something in the order of 17, 18 vaccines be delivered to children in their first few years, so the child vaccination program. That's just been turned on its head without any real indication of how the experts have arrived at this conclusion. What we do know is that the Secretary for Health, Robert Kennedy Jr., has long been opposed to vaccination generally and is certainly busy trying to weaken the system. So what's happened is that instead of the 17, 18 vaccines recommended for children, we're now down to something like 11, and we've eliminated rotavirus, hepatitis A, hepatitis B, influenza, meningococcal, and COVID vaccines for children. The outcome of this is really likely to be quite disastrous for quite a number of people, and particularly those in lower socioeconomic settings.
Yeah. So you're absolutely right that we have to trust our scientific analysis and base. And if that's eroded, then we all lose confidence. But if we look at the marginalized communities, because these policies disproportionately affect those that are marginalized, what impact do you think that will actually have in the real world?
Well, there's certain to increase the number of deaths of young children, and that is such a sad thing because for many years we've been getting on top of more and more diseases that affect young children, actually that affect people of all ages. But in this case, we're talking about young children. So it's not just these vaccines that are the problem. You touched on the word trust. And the more that the scientific evidence is eroded, then the less trust in vaccines. But your specific question was around marginalised communities, particularly the United States, and this is a United States thing, where healthcare is not free. The chances for marginalised communities who do have influenza, who do have hepatitis A, hepatitis B, the chances of them getting treatment at a reasonable cost is really remote. And so what we wind up with is those people being the children being much more vulnerable. To me, it's simply unconscionable.
Michael, we often see these concerns about the role of the federal government, but also hesitancy, doubts being put into parents' minds about the safety of these vaccines. Could you just reflect on your thoughts about how this might spread globally, concerns that not only are confined to the United States, but could have a domino effect around the world?
Well, the United States has taken amazing health leadership over many, many years, and the Centers for Disease Control in Atlanta have been the most prominent health advisor for international groups. Even the World Health Organization has regularly relied on the work of Centers for Disease Control. It's all been turned upside down, and now we need to actually look and go, okay, why have the Americans changed this policy? What is the basis of it? What is the scientific evidence? The trouble is, when you read the American analysis of this, and I've just read something from Stanford University, what you understand is there is no genuine scientific basis for this. This comes from cherry picking the data. It comes from a position led by the Trump administration, particularly the health area, to undermine vaccination from an ideological perspective. So internationally, though, people will look at that and go, well, if it's good enough for the Americans, then obviously it's good enough for me. And that, I think, will wind up putting at risk many, many people across the world.
So finally, we have the 18th Congress, the World Congress of Public Health in Cape Town in September 2026. The focus is going to be on equity and health. And of course, this policy on vaccination will be foremost. What message would you give to those that are preparing their lectures or their abstracts or research? What type of messages on this global platform would you like speakers to promote?
Look, fundamentally, public health has always been about equity. It's not about the individual, it's about how we look after populations in a healthy way. Vaccination is recognised as a foremost preventer of sickness and ill health after clean water and sanitation. So clean water and sanitation are the fundamentals. The next, as we know, a vaccination, and this has been verified by the World Health Organization a number of times. So what I think at the World Congress we should be hearing from many speakers is what is the impact of these sorts of decisions on marginalised communities, on those who are less well off, as well as the leadership in general communities. So there's a leadership issue, there's a advocacy issue, and there's a general equity issue. All of these need to be worked in to the most effective papers that we expect to hear at the World Congress on Public Health.
Good. Michael Moore, Chair of the WFPHA Immunisation Committee, thank you so much for joining us. And thank you for also putting the call to action together and promoting it so well. Thank you.
My pleasure.